hit record. So just for everybody that's on, we are actually recording as well. So we can provide the audio and the video for folks that aren't able to join us today. So hopefully that is working. It looks like it is. Okay, great. All right, so thank you everybody for joining us today with UNC Health. We're trying to provide a number of subject areas that folks would be interested in during the COVID outbreak and trying to give you a variety of topics. So thank you so much for joining us. Today's call will only be 30 minutes and it will focus on how UNC Health is working to help reduce caregivers' stress and anxiety during the coronavirus pandemic. So I will now turn it over to Alan Wolf, and Alan will introduce our guest speaker today.
Hey, Dr. Meltzer-Brody. So Dr. Samantha Meltzer-Brody is chair of the Department of Psychiatry at the UNC School of Medicine. She also serves as the director for the UNC Center for Women's Mood Disorders, and is a world-renowned researcher in perinatal and postpartum depression. However, she's also passionate about helping health workers, physicians, nurses, other caregivers avoid burnout and reduce stress and anxiety, particularly during critical times like this. She is the founder of the UNC Wellbeing Program and the Taking Care of Our Own program, both resources for UNC School of Medicine and health employees. Dr. Meltzer-Brody, thank you for joining us, and I'll let you take it from here.
Great. Well, I'm glad to be here this morning and happy to share what we've been doing at UNC to be really thoughtful and mindful of how we are taking care of our healthcare workers during this challenging time. So I can tell you some about our program and how we've started it. So we have a commitment to well-being of our healthcare workers that began quite a while ago, initially starting with the epidemic of physician burnout and then expanding across the entire workforce. So a few years ago, we expanded from a physician-focused program to the UNC Wellbeing Program. You can see information on our website and find out all you'd want to know about it, but it is essentially focused on the well-being of our entire workforce. And across UNC Health, that is 35,000 people, regardless of whether you're a clinician or a non-clinician, we are all in this together. We have developed comprehensive services to help address mental health concerns, emotional health concerns in our workforce. And during the COVID-19 pandemic, we have really expanded what we're doing. So this includes having a warm line where anyone can call and speak to a trained mental health care provider in real time so that we can assess what they need and then get them into appropriate level of services. We've been doing an enormous amount of psychoeducation to provide our workforce with information on how they can take care of ourselves and to expand our program to see people for mental health care, connect them with other services, develop online support groups, and a number of other things so that we are being very, very proactive and thoughtful about how we take care of our workforce.
Great. And so now we're going to use as much of the time as we can for questions from the media. And if it gets a little slow going, then we'll ask a couple just to sort of to keep us moving. So if everybody could unmute yourself and we'll just open it up to questions from the media. Just jump right in.
Right. Dr. Meltzer-Brody, while they're getting themselves set, can you talk a little bit about what your folks are hearing from frontline workers now, and then also talk a little bit about what we should expect in the coming weeks and months?
So as the department chair of psychiatry, we are extremely mindful that there is expected to be an enormous mental health need, both among all of our healthcare workers and the general population. So the pandemic is unprecedented for most of us in our lifetimes, and it is something that is causing a significant amount of stress. That would be an obvious thing to say, but it can be experienced as very traumatic. The social isolation, social distancing is extremely difficult for people. For our healthcare healthcare workers. They are dealing with extremely difficult situations. For example, our frontline teams are taking care of people who may be facing critically ill or life-threatening situations, and they're unable to have their families with them. So our healthcare professionals are now being the last person often with the patient and having to communicate with family members in a very unusual way that can be really traumatic for everyone involved. We are making every effort to support our frontline healthcare workers, our medical intensive care unit staff, our emergency room staff, and having what is seen as evidence-based support around these difficult situations. But we are preparing on how we take care of our whole workforce. One thing we have to consider is that for our workforce, many of our employees across UNC Health are also facing economic hardship. A spouse may be out of work, so they may have a family member who's sick. So there are multiple different aspects of stress, and we are trying to figure out how we support people broadly. I feel very fortunate that the leadership of UNC Health and the School of Medicine have been so proactive and have invested in this program, realizing how vital it is. And we are in psychiatry planning to expand how we deliver services, including with tele. So the last thing I would say now is that we've transformed our entire outpatient department to telepsychiatry so that we can reach people anywhere across the state in ways that we weren't able to do before. And that's really a very, very important step forward.
Great. If we have any questions from the media, please jump in and ask.
Hi, good morning. Oh, okay. Go ahead.
Go ahead. Okay. This is Sarah Obaska calling with NC Health News. I'm going to pivot a little bit away from the healthcare worker mental health and ask a little bit about the postnatal partum and prenatal partum and kind of what you're seeing in terms of this pandemic and the effects on women who are expecting or have newborns at home, and kind of what in particular kind of what you're seeing and what type of supports these women can have.
It's a really great question. So for many different vulnerable populations, and pregnant and postpartum women are one of them, these stressors present very unique problems. And so we are seeing higher, certainly levels of anxiety and depression and stress in our pregnant and postpartum women. And that's something that our perinatal psychiatry team and others are making an active effort to reach out. Again, we have transformed to telepsychiatry, so we are able to continue providing care, which is so important. So we are really being very proactive. Anyone that needs care can get care, and through telehealth and telepsychiatry. So our entire services are focused on that group. We're working with our colleagues in OBGYN, but this is a vulnerable population, and it is something we're watching carefully and wanting to do everything we can to increase supports.
Great.
Thank you.
Melissa, I think you had a question.
Yes, I'm calling from WUNC. I was wondering, you're saying that you're working to increase efforts to help the mental health of healthcare workers, but can you say a little bit more about what those efforts look like? Like you're talking about expanding telehealth care, which is great, but is that telehealth care available for healthcare workers also? And what other efforts are being made? Like, do they have expanded access to therapists or more sick days, or what does that look like?
That's a great question. So I mentioned at the very beginning, and it's definitely worth repeating. So one of the things we've done during the COVID-19 pandemic is to start a free of charge service. So any healthcare worker or any employee can call a warm line and speak with a mental health care provider, have a conversation to understand what's going on, understand the stressors, understand the needs, and that is all free of charge. And then that after that conversation, we can make decisions on what is the most appropriate next level of care. And that can be referring to a variety of different things. It can be referring to a social worker, a psychologist for therapy. It can be referring to a psychiatrist or someone for medications. It can be referring to an employee assistance program, or using a number of our online and other resources. We've started many specific different groups, as I've mentioned, both free support services and webinars, as well as debriefing sessions in are some of our highest risk healthcare worker populations. So on our website, UNC Wellbeing Program, you will see a huge number of resources. But one thing that we felt was critical is anyone that needed to talk to someone could call and have a warm line where they could connect and talk to a trained mental health provider and then figure out what are appropriate next steps. And so we have expanded all the services you mentioned, and we are really working to be prepared and with our wonderful mental health colleagues in the community to figure out how we can refer people and connect them with appropriate resources moving forward.
And Dr. Meltzer-Brody, on that, when you talk about the website, you mean the intranet?
No, so I mean that on our UNC Wellbeing Program website, we have intentionally made it available so that you can, at the top right-hand banner, it says support for COVID-19. This is available, publicly available to see what we have offered, and then more details can be offered, behind UNC firewalls. But we've intentionally allowed this to be available and easily accessible so people can understand what's going on and can easily access it.
Great. We had a quick question. Rose Hoban with North Carolina Health News says, do you have enough providers to respond to all of the folks that might be looking for support or services?
So we are making sure that we are working in partnership with the community, with employee assistance programs. There are many different supports available right now to healthcare providers. So we certainly are going to try and absorb as many as we can ourselves. That's the intent. We've greatly expanded resources. We are also working closely with community providers as well. And so the most important thing is that anyone that needs help, that we are connecting with help and connecting them quickly. And we are working on that. Given that most places have now moved to telehealth and telepsychiatry, and thankfully the payers are really stepping up to do that now. And I really hope they're going to continue after this acute crisis, because what we are anticipating to see longer term is that the acute COVID cases will decrease, but the mental health issues will perhaps blossom and remain more difficult, both for healthcare workers and the general population. And so we really need to be prepared for that. And we all need to be working together to figure out how we're going to take care in a very timely, thoughtful way.
Another question we got via chat, also from Rose, Rose says, this sounds like it's a voluntary program. So if people want to talk, they can access it. Are there also efforts to do group debriefs with healthcare workers and say maybe the ED? And would there be anything mandatory?
So a really interesting question. So we have started, and it's launching now, debriefs with our medical intensive care unit staff that's moving into emergency department staff. This is run by leadership in those areas. And I believe that the idea is that the people participating in care of the most critically ill COVID-19 patients will be asked to participate in this. I think that as we see how people are doing, we are getting calls from concerned colleagues about someone, and we're really working hard to decrease any stigma. Healthcare providers can have a lot of pride, not want to feel that they have to reach out for help. We're really trying to decrease stigma through education, encouraging our leaders and directors to reach out and make sure that the healthcare staff, doctors, nurses, respiratory therapists, whoever it may be, that anyone who seems to be struggling, we are being very proactive to ensure they're getting help they need as soon as we can.
Great. Any additional questions from the group, from the media?
This is Sarah again, Sarah Obaska. With this warm line number, can you, I missed when it was launched. I don't know if you have the date it was launched. And also, are there any numbers attached to this yet about how much it's been accessed?
So we launched it about a month ago during when everything really started heating up, and we moved to social distancing and the university started shutting down. So that's about a month ago. The access and the rate of use keeps going up. And so we are anticipating that will continue to be the case. And again, as I mentioned, one of the things everyone is worried about nationally is that for many people, they are getting through day by day, and they are trying to deal with this. And as this acute crisis will recede over the next period of time, whatever that may be, that the mental health concerns, depression, anxiety, stress reactions, and for some people PTSD may manifest. We have to remember there's a number of other things happening now that are really worrisome. So we know rates of domestic violence are going up, substance use potentially as how people are coping in their homes. People that had mental health concerns before, this type of stress is probably not going to make it any better. So I think that we can see a number of things are going to escalate mental health concerns, as well as the economic challenges, both for our healthcare workforce and for the general population.
All right, but do you have any numbers attached to that? Like, you know, they get 100 calls a day or any type of ballpark that?
Yeah, so it is rapidly going up, and we're seeing an increase. We are not releasing right now exactly the number of calls we're getting each day.
Okay.
Additional media questions. I know we've got several folks on here, REL, ABC 11, News and Observer. Well, while we're, maybe folks are thinking, but let me ask you a quick question too. I saw a national news program last night. They were covering the same subject. And one of the things that they were saying was that it's sort of, the conditions now are akin to PTSD. What, is that accurate?
Well, I think there's no question that what we are going through is being experienced as a trauma, and it is a population level trauma. We are all going through this in some degree, and what that means for any individual is, are they personally affected? Do they have a family member personally affected? Are they a frontline healthcare worker? For our patients and for healthcare workers who previously had a trauma history, who previously struggled with anxiety or depression. So all of these things come to play. But yes, we are worried about acute stress response, which is within the first month after a trauma, and then PTSD, which is after that, and symptoms that can be really, really debilitating. So that's something we're very concerned about. This is part of a national conversation. What I'm very proud about to be part of at UNC, and again, the support of senior leadership, is tackling this right away and making sure we're expanding this. So what we are doing, I think, is ahead of the curve in many ways. We are getting calls, it's worth mentioning, from other institutions across the country because of what we've put together quickly. And I'm getting called regularly as places try and respond to this. So I think being on the front side of the curve to say, we know this is going to be a problem. How are we going to thoughtfully respond? The state of North Carolina, DHHS, just opened a support line for any healthcare worker across the state, which is important. And they recognize that not everyone's going to be able to do what UNC has done. So we had a well-developed well-being program before, and we've been able to markedly expand that. And the amount of support and willingness and kindness of our faculty from across all departments to really step up, to volunteer their time, to run the warm line, to participate in this, to expand what they're doing, has been really tremendous and very heartwarming. So I think a place the size of UNC has the ability to do that to some extent. Many other places it will be more difficult, or they don't have a large mental health faculty to do it. So what we've been able to do is unique, and I think can serve as a model for what can happen other places, and then figuring out how do you offer this kind of care across the country in a way to prevent us from having real trauma, and as you mentioned, PTSD being persistent.
Great. We've got a chat question, but I want to see if there's any on the phone, any questions.
Hi, can you hear me?
Hi, Lynn, go ahead.
Okay, yeah, hi, Doctor. I'm wondering how much concern you're hearing from medical personnel about their own safety and the safety of their families. I'm wondering, I'm thinking that might cause a bit of anxiety, just people being concerned that they might be taking the virus home.
Oh, absolutely. That is an enormous concern. And I think that UNC has been really fortunate to roll out a very aggressive program to ensure there's adequate PPE. So as the stories were being reported around the globe, when there was inadequate PPE, you saw much higher rates of healthcare providers getting quite ill and or dying of COVID-19. That's certainly of grave concern. Those rates go down considerably when people have adequate PPE, which UNC Health has worked extremely hard to do. And there is now a very aggressive program to ensure we are doing that, what would be considered, I think, the most aggressive standards possible. Yet, healthcare providers are extremely worried about that. And that's why you're seeing both here and in other places where healthcare providers working with COVID positive patients are making sure they are, having very sort of complex ways of leaving all clothing at the hospital, of disrobing before they're in the house, of sleeping separately from family. Some of them are quarantining themselves from family during the time they're actively working with patients. This can be extremely heartbreaking for families to have to go through, especially with small kids who don't understand what's going on. Very, very difficult on the healthcare worker to have to be in these intense conditions and not be able to go home and hug your kids or partner. So it is enormously complex and unlike anything we've really seen before. And so these are things we're taking very, very seriously, as is being discussed here and nationally. But I think UNC is being really, really, I would say, intentional, deliberate, and very proactive in how we're trying to mitigate the adverse psychological consequences of all these difficult things.
Thank you.
Dr. Meltzer-Brody, one of the chat questions we got was, what are some of the biggest things that people are bringing to you? And I think they mean by that is like what you're seeing the most, maybe.
Yeah, so I think that we're seeing a lot of generalized anxiety, a lot of worry that can interfere with sleep. So people that can't sleep are having horrible nightmares, people that are having difficulty getting through the day. We're hearing reports of crying spells or feeling panicky, feeling just this sense of dread. One of the things I'm really concerned about is the potential rate for increased suicide. And so I'm worried about that in some of our young people. We're hearing reports of some of our young people with college students, family members are coming forward who may be healthcare employees saying they're really worried about their young people whose lives have been disrupted, and they are having a hard time, seeing what they're going to do next. The economic hardship that's hitting families. So I think this is going to impact everyone in many different ways. But anxiety, depression, again, dysfunctional family settings where there can be domestic violence or exacerbation of substance use that's going to compound all of these things we talked about are really, really challenging. So when people get stressed, it can bring out the best in people and it can bring out, the worst in people. And mental health concerns we know are so prevalent given that this is something that's really unprecedented and so severe.
Great. I think Rose Hoban may have a question. Rose, are you?
So, can you hear me?
Yep, we got. Yep.
Oh, great. So, you folks are providing this for UNC, and UNC is a fairly well apportioned system, but there are smaller systems that may not have the capacity to do this kind of thing for their healthcare workers. I'm guessing this is open to all the folks in the UNC system, but what about, what are you hearing from outside the UNC system? If you're hearing anything from, smaller systems that might not have this capacity, or is there a potential for opening it up to them?
Well, it's a great question. And I think that for larger systems that do have the capacity, I think we are sharing what we're doing and hoping to help be a model. As I mentioned, DHHS under Mandy Cohn and Cody Kinsley's offices have worked to open up a warm line for any healthcare worker across the state. So I think that they're very mindful that smaller systems are not going to have the resources in terms of a large number of mental health providers to do this. I agree with you completely. It's something we have to think about broadly, and I know that there's some other efforts statewide to think about how do we ensure that any healthcare worker has access to this. I think the other related question, though, is there's healthcare workers, and then there's the entire general population. And you know, there's been an under-resourcing of mental health services nationally and locally. It's been part of the national you know, issues for a long time. And then when you add this type of national trauma or global trauma, how are we going to ensure that we have adequate number of mental health providers? I think one of the most critical ways we can do that is continuing to offer telepsychiatry broadly, which means that the payers are going to have to continue to pay after this initial acute episode, so we can deliver care to people you know, across the country and in North Carolina, across the state, where so many people live in rural areas and don't have easy access, and then figuring out how we're just going to do population mental health in a different way. So I do think telehealth, the ability to rapidly change to that. We've been saying we've done, you know, a few weeks of work in something that normally would have taken 5 years or more. It's been really, really intense trying to scale up for that, and this is being played out nationally, but it's a huge opportunity for us to deliver mental health care in ways we haven't had the chance to do before.
So our Zoom meeting is going to end in just a couple of minutes, but go ahead if you've got another question, Rose.
So, you know, I think one of the things in terms of helping folks cope is sort of consistent messaging from, you know, consistent messaging. And are you hearing people concerned about some of the inconsistent messaging coming from our leaders?
Well, I think that we are living in a time with enormous complexity and ambiguity, and everyone wakes up every day to feeling like they're trying to walk on shifting sand. And all of that is just very, very difficult. And depending on anyone's sort of makeup on how well they do with uncertainty and complexity, that can be, you know, more or less worrisome. But I mean, this is of a magnitude where it's worrisome for everyone. And I think that that's something that we're going to be wrestling with for a long time as we navigate this challenging process.
Great. All right. We probably have time for one more question. Are there any more questions from the media? And don't worry if you've asked one before, you can ask again. It's fine.
Hi, this is Celeste again. I do have another question, but if someone else who hasn't asked yet, I can wait.
No, go ahead.
Okay. I'm wondering, how do you evaluate how effective all of this is? Do you follow up with healthcare workers if, let's say, they call the line and then they get referred to a social worker? Is there a way to follow up with that healthcare worker and that social worker to make sure that that healthcare worker is getting what they need? How do you know whether or not it's all working?
It's a really important question. We are going to be trying to make sure we are able to track people and make sure anyone who reached out for help is doing okay. I think you're absolutely right. We have multiple different ways we try and measure stress among our workforce. We're looking at additional ways of how we're going to be measuring stress longitudinally, but I completely agree. We have to have metrics to understand that if someone reached out for help, did we successfully connect them into services, and whatever those things were they helpful to that individual? And ultimately, you know, the mental and physical health of our workforce at UNC, and then as we think about what that means, you know, outside of UNC and broadly, is of great concern to all of us. So I think that's a really important, thoughtful question. We are taking lots of steps to address it.
Great, thank you. Oh, sorry, there's a follow-up. Go ahead.
Yes. I just have one quick question. You mentioned telepsychiatry. Are those one-on-one sessions, or are you having group therapy sessions?
So it's great question. So we are doing a lot of one-on-one, either individual psychotherapy or with a psychiatrist or prescriber, but now we're offering no charge free group therapy sessions. Those are right now geared at our healthcare providers. Everything else I mentioned is both for healthcare providers and the general population, but we are going to be expanding to do group for the general population too. So I think that it will be both individual and or group, and really trying to figure out what are best practices to deal with the anxiety, depression, stress response, and then certainly thinking about how we do best evidence-based approaches and treatment approaches for trauma-related things and PTSD moving forward. And I think they're all going to be needed.
Thank you.
Great. We are out of time. It's 10:30. Thank you everybody so much for joining us. We really appreciate you taking time, and we hope this has been helpful for you. We will continue to do these. Right now, our schedule is doing these on Mondays and Thursdays. We'll send the invitations with the information about who the speaker will be and all the details of how to get into the Zoom meeting on the day before. So thank you again for joining us. Dr. Meltzer-Brody, thank you for being our speaker today. We will also make a recording of this meeting available online. So if you missed something, if you joined late, or you need some more information, please check that, and we'll send that link out to you when that becomes available. Thank you very much. And this concludes our meeting for today.
Okay.